Now, Parkinson's disease is the fastest growing neurological disorder in the world, according to the U.S.'s National Library of Medicine. An estimated 12 million people worldwide are expected to be living with the disease by 2040. Well, Surrey Memorial neurologist Dr. Jason Chen recently won the 2025 Michael Smith Health Research BC Health Professional-Investigator Award for his Parkinson's disease research. And we are so pleased that Dr. Chen is with us in studio right now. A very good afternoon to you.
Thank you for having me here, Gloria.
And congratulations on this recognition.
Thank you.
So how would you describe Parkinson's disease and what possibly causes it?
Yeah, so Parkinson's disease is a disease that is neurodegenerative, meaning that brain cells are lost over time. And in Parkinson's, the specific brain cells that are affected are the ones that make a chemical called dopamine. In the public sphere, dopamine is probably best known as the happy chemical, but with Parkinson's disease, we know that that is a much more complex picture. And so when the brain loses these dopamine-producing cells, people experience slowness of movement, stiffness, tremor, among other movement-related symptoms. And as the brain networks change, patients often experience non-movement symptoms as well, affecting cognition, mood, anxiety, blood pressure, and a whole bunch of other things.
Okay, so your research has gained this recognition. Well, what can you tell us about it?
Yeah, so the research program that we're trying to build up in Surrey, along with Simon Fraser University and within Fraser Health, is to look at how patients' brains respond to dopamine medication over time as medication takes effect and then perhaps even wears off. And the reason why we're looking at this is because people with Parkinson's are quite variable, meaning that no two people with the disease are alike. Each patient or each person with Parkinson's will experience the disease very differently in terms of what symptoms they have, in terms of how the disease changes, in terms of how the medications work for them, as well as what side effects they get. And so the idea of our research is to use advanced brain imaging in the form of magnetoencephalography, or MEG, and magnetic resonance imaging, in MRI, to track these changes of brain activity basically over the course of a patient's dopamine dose taking its effect.
Okay, how long a period is that? How long does a dopamine dose last?
That's a great question. And so that's part of the variability. So most people with Parkinson's will experience the onset of effect within 15 to 30 minutes, some up to an hour. The maximum effect typically takes place somewhere around 2 hours, and the duration effect is quite variable, right? So many people early on in their disease can have a duration of effect, upwards of 8+ hours, but it's quite common over a disease course as someone gets older with Parkinson's for that time frame to shorten.
Okay, so this award comes with $90,000 a year for a 5-year period. Mm-hmm. How far will that take you?
Yeah, so you call it a reward, and in a way, it's more of a way to get more work done.
Okay.
Right. So research in general needs resources in terms of funding, actual physical equipment, supplies, personnel. The award is a salary award, which means that we can use this money to hire on personnel to take part in the research program, to build the research program, to really get it moving. And research is not a solo effort by any means, and so it's really about building the core team around this project.
I see. And what do you see as sort of potential limitations to this type of research?
Yeah, in terms of the limitations, one thing is the population we intend to study, right? So unfortunately, Parkinson's disease is often a prolonged disease, it is a lifelong disease, and people can live with it for decades. By that nature, though, we have to narrow our scope of what we're trying to study, and so the study is geared more towards earlier stage Parkinson's disease, so what we consider mild to moderate. And so in this study, won't be able to actually see what happens later on in life, but that could be an extension in the future.
I see. Well, it's interesting because we understand that Surrey Memorial Hospital opened a deep brain stimulation clinic in June as well. And I know this takes us a little bit off the path of your research, but what can you tell us about that?
Yeah, so in addition to being trained as a Parkinson's and movement disorders neurologist, I'm also trained as a deep brain stimulation neurologist. And BC as a whole has been very fortunate to have had and still has a neurosurgical deep brain stimulation program based out of Vancouver General Hospital and UBC Hospital. And the traditional kind of model of care there was that the Vancouver DBS clinic would do the aftercare, the programming of the stimulator devices for these patients, and the neurologist, whoever that may be, would take care of the neurological care. Me being in here in BC, I figured, well, why don't we try to combine those two and offer both DBS programming and neurological care for movement disorders patients all at the same time, which really is, in a sense, the gold standard worldwide. So we had the opportunity to create this clinic based in Surrey, but really it's a program that's going to serve all of the Fraser Health region, and we're hoping to at some point grow it, right, and basically collaborate with the existing infrastructure, with the existing programs to provide more and better care.
Well, that's encouraging to hear. I know there's a whole lot of mystery surrounding, as you point out, the difficulty in that every patient has their own journey and it manifests in different ways in different people. What gives you most hope today in terms of Parkinson's research?
Yeah, I think it's understanding more about the disease. Because one of the big problems of Parkinson's disease is that we don't understand enough of what causes it in terms of what drives the disease. And what we understand to be Parkinson's today probably is not one disease. It's probably multiple different diseases that look syndromically very similar with very similar symptoms. And the drive for the hope, right, is how can we understand these diseases better to provide better care, improve quality of life, and really make an impact.
Well, Dr. Chan, thank you very much for being with us today, and congratulations again on the recognition.
You're very welcome. Thank you for having me.
Dr. Jason Chan is a neurologist at Surrey Memorial Hospital, and his team recently won the 2025 Michael Smith Health Research BC Health Professional-Investigator Award for his Parkinson's disease research.